video will demonstrate an example of rib diagnosis. We will demonstrate how we will come to diagnosis of exhalation dysfunction of ribs 2 to 4 on the left. Generally, the patients will be in supine position except when you need to screen or diagnose rib 11 and 12. Then you will screen the rib cage to narrow down the area of interest. Then you will palpate the individual ribs to determine your final somatic dysfunction diagnosis. Let's start by assessing the rib cage in the general way to look for major discrepancies in their motions. This is the screening portion. We start with engaging the rib 1 by finding C7 and coming lateral and dropping down to the thoracic inlet region. You should be in front of the trapezius. Sometimes you can see the surface anatomy of the course of anterior scalene as it courses down to the first rib. Using your thumbs, palpate down to the rib 1. Then have your patient breathe in and out. In this case, rib 1 is moving symmetrically, moving up with inhalation and moving down with exhalation without any noticeable discrepancies. For rib 2 to 5, contact the ribs laterally to the sternum, generally by laying your hands over the pectoralis region. Have your patients take a deep breath in and out. This patient has less motion and inhalation on the left, somewhere in the rib 2 to 5 region. Likely, your patient has exhalation dysfunction on the left. Plan to come back to this region for more specific diagnosis, but at this time, move on to the next region for screening. Now, unless you have long arms like Dr. Survey, please contact your patient's rib cage as shown in this picture for ribs 6 to 10. Contact the rib cage for rib 6 to 8 region by lining up your palms at mid-axillary line. Assess for symmetry while patient inhale and exhale. Contact rib cage, ribs 8 to 10 region, and line your palm at mid-axillary line. Assess for symmetry while patient inhales and exhales. In this case, the patient's ribs 6 to 8 regions are moving symmetrically. Now to screen the ribs 11 and 12, ask your patient to switch to prone position. Place your hands and/or fingers directly over the ribs 11 and 12. Ask your patient to inhale and exhale while you assess for symmetry of rib 11 and 12 motion. This patient has symmetric motions of ribs 11 and 12. After your general assessment, now you have to go back to rib 3 to 5 region that was asymmetric. So go back to the rib 3 to 5 region and start assessing individual rib motion by asking your patient to inhale and exhale. In this case, ribs 2 to 4 restricted in inhalation, stuck in exhalation, but rib 5 moves symmetrically. So your final diagnosis here is ribs 2 to 4 exhalation dysfunction on the left.